Welcome, everybody. We'll go ahead and start if that's okay. Great. Welcome today to join our webinar. My name is Elizabeth and I'm from CBM Global, and I'll start off with a few housekeeping items. The event will be recorded and shared later. We have international sign interpretation and live captions in English. If you need captions, please click on the Show Captions icon at the bottom of the screen. And we also have a separate link that is in the chat box. We will keep our cameras on, the presenters and moderator, but we ask that you keep yours off. And we will wait to answer questions until the presentations are done. But feel free to ask questions by typing in the chat box at any time. And then later you can speak or type however you want. But for now, just type into the chat box, please. So as an introduction, the International Disability Alliance and the stakeholder group of persons with disabilities with CBM Global are proud to present 2 reports around data and persons with disabilities. The goal of the survey was to assess our joint disability data advocacy toolkit and to explore data gaps and to look at data gathered from organizations of persons with disabilities. So 2 reports emerged from these findings. So lessons learned from the Disability Data Advocacy Toolkit, and second, a compilation of case studies specifically led by organizations of persons with disabilities, including citizen-generated data. First, we will have Jose Vieira present. He is permanent representative of the stakeholder group of persons with disabilities and interim executive director of the International Disability Alliance. And he will give us an introduction, and then we'll pass on to our main presenter, who I will introduce in a minute. But Jose, for now, go ahead. The floor is yours.
Thank you, Elizabeth. Thank you, Sarah, and thank you particularly to all the people who have joined the webinar today. It is a great honor for me to be sharing some of the thoughts and findings around this disability and data agenda. But let me start by saying that for the disability community in general, and particularly from IDA, we understand that there is an increasing need for collecting more data on persons with disabilities, but actually trying to advance also in how we use data. I think we can, after many years of advocacy and joint collaboration, conclude that there is a more clear understanding about the importance of data and persons with disabilities. But at the same time, we still see a big gap between what is the role of OPDs in this agenda around data and disability. Number 2, how OPDs can also be equal partners into this agenda. If we move on from a perspective where OPDs were just the last piece of a chain for validation, and clearly becoming partners in the collection, use, and advocacy strategy for data. And the last thing that I would say in this very short summary of how we see the bigger picture with regards to the data and disability agenda is that many stakeholders, and not just governments or national statistics offices, but NGOs, UN agencies, private sector, civil society in general, are all moving fast in developing new ways of collecting data, of new ways in which they generate data, and initiatives like citizen-generated data is something that we as the disability community should be more and more involved. I would like now to share with you some of the findings after a study that my colleague Sarah will also address later on in this webinar about the use of a toolkit on data and disability that was co-produced by IDA, CBM Global, and the stakeholder group of persons with disability a couple of years ago. And it's very interesting to see how after a few years, organizations of persons with disabilities are already reporting back about how they are using the toolkit. And on one hand, what has been unlocked by the use of this toolkit in terms of strengthening our engagement in this agenda, but at the same time, what are still some of the areas that require further improvement when it comes to OPD engagement in the data agenda. So this toolkit was developed, as I said, by CBN Global, IDA, and the stakeholder group of persons with disabilities. We have consulted approximately 34 OPDs, quite diverse from different regions, from different constituencies. And some of the most interesting uses that this toolkit, OPDs have been using this toolkit are basically to advocate with their respective governments for more and better data. The next funding is clearly how the toolkit has strengthened the capacity of OPDs in using concrete data collection tools like the Washington Group set of questions and other alternatives. The next funding is, I would say, even more interesting because OPDs are reporting that because they have been strengthened in their capacity to collect and use data, their initial practices or initial initiatives where the data that they have been advocating for is being used for what we can call policy work, discussions around issues like employment, social protection, inclusive education, transport, etc., etc. Now, those discussions, those advocacy strategies, thematic advocacy strategies, are being somehow backed up by solid data and evidence, which in the end is what we as an advocacy organization and most of OPDs working in the advocacy agenda should be doing, shifting from a approach where we went to policy discussions with what we believed was happening to a new scenario where now we go with data and evidence to solidify our position before those topics. The next interesting funding, and there are quite a few, I will just mention one or two more, is the fact that the toolkit has enabled OPDs to engage with other civil society organizations in the broader data agenda, right? And I would say here that it's very interesting to see how this toolkit had enabled OPDs, for instance, to be more engaged in the new citizen-generated data agenda, because it is a fast-growing agenda. It is an agenda that is being discussed in different structure and places, right? And we as OPDs should have a say in this fast-growing citizen-generated data. But I will come back to this particular topic a little bit later. The last funding is primarily, I would say, an overall funding that is basically that the toolkit has allowed OPDs to engage in a new, or for a lot of them, a new agenda, a new area of work, which is data and disability. And as we all know, actually, we are still facing this big gap between what is happening at the international level with regards to this agenda and what is actually happening at the local level with regards to real change, right? So I think in many different fronts, we all experience this fast growing international level discussion in different agendas, but we all know that to taking it down to the local level, it takes time. So another very good funding or result of the use of this toolkit is the fact that OPDs are now realizing more and more that they should also include in their overall strategy, advocacy strategies, the data and disability agenda. On the other hand, this quick report about how the toolkit has been used by OPDs is telling us concrete areas in which OPDs are reporting we should do more. The first one being a more strong and effective advocacy strategy, especially with other civil society and governments, UN system, agencies, etc., for including OPDs meaningfully in the discussion around data and disability. It is clear that so far, besides some fantastic examples and very concrete national and regional level initiatives, OPDs are yet considered only as a validation mechanism for a lot of the disability and data initiatives. And clearly, we should do more to recognize the importance of OPDs engagement in this agenda. Number two, OPDs are reporting back that clearly a further investment is needed for developing the capacity, the skills of OPDs in this agenda. And while they all recognize the importance of this toolkit and how effective it has been, they all agree, or most of the OPDs that have reported agreed that it's a very initial, general first approach, and it requires more specific the modules or more specific training opportunities about different components of this agenda. The last area in which OPDs have identified a need for further development is related to including underrepresented, up to what extent most marginalized constituencies are being involved in this agenda, and issues like accessibility, inclusivity, etc., should be considered moving forward if we want all constituencies to be engaged in this agenda. As you can see, the findings of this reporting exercise is telling us, on one hand, what's working well and what still is a gap. And trying to understand the different gaps, I would like to connect it to some of the new agendas, and that is the citizen-generated data initiatives that we are all seeing is coming along with different angles, with different perspective. And we understand that OPDs have a critical role, I would say, for two main factors. One being more historical, and that is the OPDs have been, maybe without knowing that we were doing this, but we are a source of data. The fact that many OPDs around the world have been serving all persons with disabilities, have been providing services to persons with disabilities, in many cases have been stepping in when states were absent. Just that only perspective tell us how much valuable the data that OPDs have can be for this bigger agenda. And the other factor, which is, I would say, a bit more kind of recent, but equally important, is the fact that OPDs, in most of the cases, are well positioned within the civil society networks that we know are kind of the driving force for this citizen-generated data. So while we understand that still there are very good and interesting conversations around the validation process of the citizen-generated data, by the capacity of the citizen-generated data to be comparable and being able to extrapolate models from one country to another, and to what extent we can scale up those initiatives. Clearly, the fact that there is an increasing process out there around citizen-generated data speaks that OPDs have a fantastic opportunity to shape that process, not only because we can bring data collected previously and elements that can help, but even more importantly, because we have another area in which we can influence, or another tool that we can influence other stakeholders collecting data for them to do it in the most inclusive and accessible way. In closing, because I really would like to pass the floor to my colleague Sarah, who has led together with Elizabeth Lockwood all this process, I would say that we are really proud to have this webinar today, because I think with this webinar, we are moving concretely from the initial stage where we were thinking what we can do around data for persons with disabilities to a new stage where we are seeing how the efforts that we have put together are already impacting positively for OPDs at the national level. So I think this webinar, with many other existing initiatives, speak to the fact that we are reaching the stage in which we need to do more synchronized, more organized, making sure that OPDs are in the driving seat of this agenda, but at the same time, acknowledging that we are moving from detecting the need to actually already implementing different activities and initiatives. With that, I would like to close. Thank you very much, and I'll remain available for any question. I guess I'll give back the floor to Elizabeth. Thank you.
Thank you, Jose. And now I will pass to Sarah Rocha. Thank you so much. You have been an amazing support and consultant and leading this work for the many past months. And so I now give you the floor to present these findings. Thank you so much, Sarah.
Thank you so much. Hi, everyone. I'm Sarah. I will share my screen. I hope everything is okay. So we developed these two reports, as been said. One of them is on the Disability Data Advocacy Toolkit, what lessons were learned. And then another one is a compilation of case studies on citizen data or OPD, organizations of persons with disability, generated data. And I will start by the report on the Disability Data Advocacy Toolkit. We developed an online survey for organizations to understand are OPDs aware and using the toolkit? How is it being used? What are the lessons learned and what are the next steps needed? What OPDs need to start using it if they are not aware of the toolkit, and what kind of disability data is available in their country, and is it accurate and enough for their advocacy? And finally, what are the OPD's data priorities and challenges around disability data? We got around 34 organizations responding to the survey. 23.5% were aware of using this toolkit. It was more high-level organizations, so bigger organizations, which was a need for us to somehow reach the local organizations too. 6 were from Africa, from 6 countries in Africa, 6 countries in Europe, 5 countries in Asia, and 1 country in South America. Obviously, we needed a lot more information and a lot more responses to be completely accurate, but it gave us some really interesting feedback that I will show you now. In terms of the organizations that were aware or using the toolkit, they used the toolkit to improve capacity building, collect information and analyzing needs of persons with disabilities, consult best practices and what to avoid in presenting data, to collect disaggregated data, and to train persons with disabilities and their representative OPDs on citizen-generated data. The lessons learned from using the toolkit were, some of them were, there is a need to capture more other disability types with the Washington group set, for example, autistic persons. Organizations need training on how to use it. So there's a need for more training, especially at the local level and to reach smaller organizations. It needs to be updated often. So it needs to have a centralized website or area where there is more commonly updated information. Need to map all stakeholders involved in data advocacy. Need to be fully involved in the OPDs need to be fully involved in the decision process around disability data, and must understand the linkage between the convention, the CRPD, the CDG, the Sustainable Goals, and the Global Disability Summit. And OPDs at all levels, especially at local levels, must be empowered to engage in data advocacy. There's also a need for creativity, innovation, and out-of-the-box ideas, and a collaborative approach between different stakeholders for advocacy on disability data. In terms of organizations that are not aware that were not aware of the toolkit, they ask for support, especially on training, on how to practically implement and use the toolkit, and also other formats and languages, including Word format, translation in Portuguese, and national sign languages, if possible. So the most expressed need was a training workshop on how to manage, analyze data, followed by disability data advocacy workshop for OPDs, which are available online, and you can download the PowerPoint presentations for the workshop. Funding for data advocacy, a short informative video that can be used for teaching purposes, technical data webinar series to address evidence-based policymaking, a small data-related project, technical support, and finally access to an external data team. We asked organizations what disability data they had available. It was very interesting because all the countries that have more than one response within those countries, they actually gave contradictory responses to what disability data is available. So this potentially shows that the disability data and governmental and census data that are available in the countries are not very transparent. It needs to be more centralized, it needs to be more visible and more accessible for OPDs to access and to keep track of what disability data is available. However, only 11.8% of the responses reported that the available data provided them accurate information about persons with disabilities. There was 4 countries where they said that it did provide them with accurate information. Only 17.6% of the responses reported that the available data was enough for their advocacy. It was enough in Egypt, Bangladesh, Belgium, Malta, and Brazil. Obviously, this is a small set of samples of responses, and we would need a lot more to understand exactly the different stakeholders' opinions on the accuracy and usability of the data. We asked OPDs what were their data priorities, what they wanted to develop in terms of data, and what do they need, and especially what they don't have at the moment. These 4 points were the most common. So human rights violations, harmful practices, sexual and reproductive health and rights, including forced sterilization, psychiatric abuse, social contention, isolation practices, and deaths in psychiatric hospitals, for example, but also independent living, education, and employment. So the number of persons with disabilities in institutions or in the community, number of persons with disabilities in segregated and mainstream education, number of persons with disability in sheltered workshops, etc. So how many more details on education and employment and how independent they are living. Then we had access to services and needs, so difficulties that the persons face accessing rights and public services, specific needs of persons with disabilities and support available compared with needed, political participation and civic engagement. And finally, we had technical needs on data collection and management. So the publication of data kept by entities and ministries of health, education, transport, and employment that a lot of the times are not being published, community engagement and consultation of OPDs, and improve reliability and quality of data. You can see a lot more. In the report, you have all the data priorities that were reported, but these are some examples that we could compile. Then we have the challenges on disability data. We asked what kind of challenges there were. In terms of the most common ones were availability of data. So a lot of times data was not available. There was not capacity for OPDs to develop their own data and advocate on this subject. The comparability. So this I will address just right now. It's in terms of comparability, it's very hard to compare between countries, but sometimes even within the country. Also leadership instead of consultation. So OPDs need to take more leadership roles and not just be consulted. Functional difficulties versus disability groups. There's obviously the Washington group set is being used, but there are a lot of countries that are still not implemented. When implemented, sometimes is not fully comparable with other countries, and is important to ensure that this is comparable across countries. Methodological issues, the fact that a lot of the time data is not disaggregated by gender, by disability, etc. Barriers and facilitators to access. So obviously, according to the social model, it's not just what are it goes beyond the person with disability to what barriers they are facing, and this is sometimes not checked within the data. The lack of funding for this type of data advocacy and projects, accessibility, data reporting. So the reporting is not a lot of times accessible by the countries that are developing them. Advocacy is sometimes limited and difficult to engage with. Need for community level qualitative data. A lot of the times we have quantitative data, but not qualitative in the stories and narratives of the persons with disabilities. Data interpretation, it can be made not by persons with disability, but by other people that might not interpret it fully as the community wants. Lack of access to ethics committee and scientific publishing for credibility and for National Statistics Office to take disability data from OPDs more seriously, and limiting access to raw data. One of the most common issues that has been reported and it's been felt, it's also how it's on the comparability, how there are several levels of the government that are developing data based on different models of disability. So you have data for disability in healthcare, disability assessments, access to benefits, and others that are based on the medical model of disability. And then sometimes you have the census and governmental surveys that are based on the social model of disability with the Washington Set Group or any other type of functional questions. And then you have the OPD generated data that is actually based on the human rights model of disability. And because it is much more focused on aligning with the convention, with CRPD, and with policy needs. So this, it brings a lot of issues for organizations because it means that they can't really compare even information within their own country and use it for advocacy. In terms of recommendations on what we found through the survey, training for national and local organizations, especially if a train the trainer to engage disability advocates and local OPDs to learn how to train their own advocates. It can potentially also translate a lot more on the toolkit and on the workshops and engage a lot more the local organizations. Translation and accessibility, other formats and options of the toolkit. A database of the disability data resources to be easier to update and to add more information as much as possible for people to consult. Database with National Statistic Office information on disability data per country. There is a database on the National Statistic Office information in general, but it would potentially help to understand what disability data there is per country and how people can consult it. Developing guidelines on what data stakeholders need for their advocacy. For example, as we saw, the data priorities are not necessarily being integrated into the data that is being developed in census and governmental questionnaires. So it would be good to develop a guide with all the data stakeholders and especially OPDs to understand what data is needed at the national level to advocate for their rights. Disability rights monitoring tool with continuous funding. We need to have more monitoring tools to understand exactly how our rights are progressing, how we're advocating, and also supporting OPDs to do the same. Research on frameworks of disability for advocacy. And this leads me to find ways to harmonize the different models of disability and create comparable models of disability data. So there's a lot more need on research on how we can, what is the ideal disability data framework and how we can develop this within these different models that are still being implemented or changed over time. The second report that we did was a compilation of case studies on OPD generated data. The objective was to gather examples and best practices of OPD generated data, analyze them to show the importance of citizen generated data to complement official statistics, and provide practical examples for other OPDs who wish to collect their own data. So we managed to gather 23 case studies and OPD generated data. It goes from topics such as COVID-19, employment, access to justice, sexual and reproductive health, priorities in policy, independent living, restraint and seclusion in schools, gender-based violence, political participation, barriers to healthcare, and others. And also includes some examples of case studies where organizations that are not focused on disability included disability data. Some compilation of guides on citizen-generated data. And finally, a quick introduction to the human rights-based approach to data on how to implement that in our data collection. So just a very quick example of a case study. This is the case study 5, a COVID-19 Disability Rights Monitor that was developed by several organizations, including the International Disability Alliance. And this gives you an example of what we show, what question is explored. In this case, is what are the difficulties and experiences by persons with disabilities during the COVID-19 pandemic. It shows the organizations responsible, the location of the project, the website, goals of the study, methodology, key findings, and the results that were created and published within that study. You can consult it, and I hope it is helpful to, especially to organizations that wish to collect their own data. So as a quick conclusion, there is a need to centralize information on disability data and provide comprehensive country-specific data to organizations. OPDs need more funding and resources to advocate for the inclusion of functional difficulties questions in national surveys, as well as expanding the scope of related inquiries. So not just what is the rate of employment, but also how much is a percentage of, for example, unpaid work or sheltered workshops, or more specific questions that will support them in their advocacy. A project to map all data needs on disability by all stakeholders should take place to understand what questions OPDs and disability advocates need to include in national data, get accurate data they can use, especially within the model of the human rights model and according to the CRPD. I know that there were some attempts already to develop this type of project, but we definitely need something more fixed and lasting. The data disaggregation across all governmental areas, so not just the census, but also in employment data, disability, education, migration, social security, justice, economy, and health, to ensure that organizations have access to useful information that can actually support their advocacy. The OPD's data priorities show that more than a shift from the medical model to the social model of disability in data, organizations and advocates show an interest in reframing data from the medical model to the human rights model of disability to support their advocacy. I would like to emphasize the urgent need for qualitative data. So the stories and narratives of persons with disability, which are not normally organized and kept, and it's being used quite a lot within this OPD generated data, but not further than that. And it's very important that we gather more and more, because it gives us a larger perspective of needs and barriers that people are facing. And the participation and leadership of OPDs and advocates with disabilities in determining their own priorities and needs is of the utmost importance to fully represent, support, and advocate for the rights of all persons with disabilities. I just want to finish up with a very big thank you to the stakeholders group of persons with disabilities, to the International Disability Alliance, to CBM, and particularly to Elizabeth Lockwood for all the support on this project. And I will, I guess, open now for questions.
Thank you so much, Sarah. We have lots of questions already in the Q&A. It looks like Q&A box. So I will go ahead and start with those, and then we'll see if there are more questions from the group. So I'm going to give you a few at once, if you don't mind, and then we'll do rounds. So the first questions are, is there a reason why the Caribbean was not selected to participate? And the second question, what was the criteria used for selection of participating organizations? And a similar question, of the 34 organizations that participated, were they umbrella organizations or organizations that captured a wide group of representation of all types of disabilities? And fourth, what plans are available to ensure dissemination of these findings to ensure we reach everybody? And just to answer really quickly, yes, we will share the presentation slides later. And the last question so far, how do persons who have challenges communicating advocate for data? Are they unable to ensure qualitative data on their personal experiences? How do they make sure their qualitative data on their personal experiences is included, such as persons with deaf blindness are struggling to be included in the census? So I think, how did you include persons with deaf blindness in this survey, in this research? So I'll start with those, and then we'll come back for more.
Yeah, perfect. Well, in terms of the including of the OPDs, what we did with the survey was I went to the members of IDA and sent to all the members of IDA, and then I went to their members in each of the members and sent to them. And then there were some, for example, in the UK, there is a list of contacts of OPDs and the contacts. So we sent to all of them. Every contact that I could reach, it was sent. It just unfortunately a lot of people it didn't reach, or it might have gone to spam. It's very complicated to reach organizations. People doesn't have a lot of time also to answer more surveys. So we tried to reach as much organizations as we could, but we didn't exclude any area. We actually tried to send as much as possible to organizations, even local organizations. So if we went to an IDA member and then to their member and then to their member, I continued to go into that cascade until there is no more umbrellas organizations. Obviously, there were some organizations where I could not find a contact that we couldn't send, but I tried as much as possible to get as a wide feedback of countries. In terms of OPDs, there were several organizations that responded. Sometimes it was not even just OPDs, it was other types of organizations that are using it, including governmental organizations. In the report, you can see the breakdown of who responded. Also in types of disability, most common was the all persons with disability. Some were umbrella, but other were local organizations for autistic people or deaf people. So you can see the breakdown within the report. It just, since I didn't have a lot of time, I couldn't go into all the results. And I think the last question, sorry.
And the last
How
question.
the persons with disability and communication challenges.
Yes, you got it.
So this is why we need to map all stakeholders and try to understand what are the data priorities and how to reach them. Because I think there's a lot of, especially specific disability types within the disability community that are not having the same space and possibility of influence data as other types of disabilities. This will need to be experimented. For example, I work in a project that we were able to reach a person through a personal assistant or someone that made available to write that person's story. But obviously this is not possible for everyone, and personal assistant is still sometimes rare or non-existent in some countries. So we will need to understand how to make it accessible and possible for people to report their stories. But that's why we can't just focus on quantitative and ask the questions, because then we will have the answers that we want. We need to open to qualitative ways that include everyone and increase more our understanding of barriers and difficulties that we might not be aware at the moment and how to fix them.
Great. Okay, we have a new bunch, so I will read these out to you. What differences between data accessibility are there between different continents, especially as it relates to people with disabilities? The second question is, was there an outstanding finding or trend related to a geographic location of OPDs surveyed? And third, in what ways can we generate data or collect data? That's a huge question, but a very good one. And the next is a great question. OPDs leading data and disability, Article 31, in their country are not necessarily IDA members due to membership structure. Would IDA consider hosting a data and disability working group of OPDs, especially interested in addressing methodology, rights, and disability disaggregation and indicators in their country? I think that's a question more for Jose, since it's specifically for IDA. So we can hold off and have Jose come in to answer that. And then a comment before I go back to you. It may be a suggestion that thematic related disability data can be included to expand the types of disability data included in the database. Examples are impact of climate change and disasters on persons with disabilities and so forth. So I'll let you go ahead and then have Jose come in to answer that other question. Thank you. Sarah, I'll have you go ahead first.
Oh, sorry,
Okay.
I misunderstood.
Sorry.
Okay, in terms of geographical, unfortunately, we didn't have as much responses to actually understand that if there's a specific trend. I think the most obvious trend was in every country, and this was not specific to any area or continent, was the fact that people gave different responses to what kind of disability data they had available in their country. So that tells us something, even though it's not a specific trend in a continent. In terms of how to collect data, obviously this is a massive point, but I think you can start by using the disability, the toolkit to see, because there it gives you a very good understanding on how you can start that work. The case studies report that we are launching now, it can give you some examples of what other organizations did in different thematics and areas, and you can take some ideas and try to replicate in your own country or local area. But obviously, and if possible, increase and access the workshops of LPDs, because it will also be very helpful and will probably answer a lot of your questions on how to collect data. Finally, the thematic point, there is definitely several teams within, for example, the case studies reports, and there were, I believe, some reports on humanitarian support and disaster on disability data that you can consult, but I don't know if I responded the questions, because sorry, I have a disability too, and my memory it's not great.
You did great. You did really well. Thank you so much. And I just wanted to answer one question that I asked a little bit earlier about dissemination of these reports. We plan to disseminate this as widely as possible in different fora, presentations. We will have more webinars on this. We just uploaded the reports yesterday, so we will continue to disseminate this as much as possible. Now I want to bring in Jose to answer that question. Jose, do you need me to read the question again?
Yes, please. I would appreciate that.
Great. It says OPD's leading data and disability Article 31 in their country are not necessarily IDA members due to membership structure. Would IDA consider hosting a data and disability working group of OPDs especially interested in addressing methodology, rights and disability, disaggregation, and indicators in their country?
Thank you. Thank you for the question. Let me say first that IDA works not necessarily just with our members. A lot of our programs include any OPD that is willing and ready to work with us, right? So it's none of our work is just exclusively for members. About the creation of specific working group within IDA to work on this matter, it's something that for sure is interesting, and it's always an opportunity, a possibility. On the other hand, we really believe that there are already many ongoing initiatives and places. So we are sometimes a bit cautious of just not creating many similar structures, but I think the recommendation is well taken, and we can think about it and come back with some concrete way forward. But for sure, IDA as in our role of being that convening force among OPDs, we will have more spaces like this to discuss engagement of OPDs in this agenda. And of course, it's not just for IDA members, but rather for the whole disability community. Thank you.
Thank you, Jose. And just to add on that, we do have a disability data working group under the stakeholder group of persons with disabilities. And we have a listserv, so I'm happy to share that. I can't access, for some reason, I can't send anything in the chat, but I can send it here. And you please join and write me, and I can add all of you as well. So please do join that. And back to you, Sarah. This is probably the last round, but we do have a lot of questions. Okay. First is from Jeanette. And actually, I think I can answer this really quickly. She says, hi team, thank you for this extraordinary work. Very useful. And thanks for the brilliant presentation. I echo Emile, as disability data is important with country, and support her request for training within country. My request would be to team up and have an in-person training, and I would like to work with you. I did share it already. We have a disability data advocacy workshop for OPDs that was based on the toolkit, and it's open source, and I'm happy to share it again once I email everybody this recording, but we'd be happy to work with you. So please stay in touch about that. And that goes for everybody on here. Okay, the next questions. Is there a pool for OPDs to send their data or surveys independently conducted? This way you're also fed with a wider pool of data from different OPDs and persons with disabilities to improve disability data. That's one question. Second, thank you, Sarah, for the great presentation. Qualitative data on barriers and individual perspective is really important. Did OPDs highlight which data generating processes they would prioritize, such as participatory approaches or questionnaires? How would this relate to using the Washington group questions? Third, yes, is there an online training, which I just mentioned, and I will share that. So third, what advice do you give to OPDs and other national stakeholders to develop agreed data management frameworks? And fourth, and this has to be our last question, were the governments from various countries that received the data reports from OPDs accepted? Did they accept the reports, or were there challenges? So we have about 5 minutes. So I will have you answer these.
I'll try.
Thank you.
In terms of the pool for OPDs to send their data, it was one of my recommendations actually within this disability data website to create a potential area with examples and case studies like we did with this report, but something where somewhere where OPDs could send and share their reports. But I'm not aware at the moment if there is. I think if there is, and if they're planning to do that, it will have to be for Elizabeth and Jose after. In terms of qualitative data, if there was any process, participatory approaches or questionnaires, and how this relates to the Washington set groups, it depends quite a lot. What I noticed is that with OPDs are much more focused on asking in terms of disability, do you identify as having any type of disability? It doesn't even necessarily need to be diagnosed specifically. It just if the person identifies as a person with disability while not using the Washington set. And that's why I was saying that sometimes there's also difference between the social model of disability, which is the Washington set group, and the human rights that the organizations are using. We need to find ways to connect and compare this type and to make frameworks that everyone can use, that can be shifted and compared. But there was no specifics. A lot of different ways to do it, and a lot of examples. The online courses, again, the workshops are the best option, as we talked about before. What advice do you give to OPDs to develop agreed data management frameworks? it's a very big job to see, because every country and every area have different difficulties and barriers. Some of them are the same, but there's a lot that are very specific. And intersectionality. So I would say that we need to have an agreement and have a group that actually sits down and develops this with all the stakeholders. So it's very complicated. Finally, the governments received the data report, research from OPDs accepted the report. No, then in general, I was not aware of any OPD that said that the National Statistic Office was accepting. And this is another issue, because if we can't connect and have more sharing of the data, it will be a lot more difficult. But it has to do also with for example, lack of access to ethics committee also, or publishing in a scientific way, or something that provides credibility to organizations to then be accepted by national statistic offices. And I think this is something that needs to be advocated in the next few years by organizations to ensure that this connection will happen and OPDs can share their studies and data collection with the statistic office. And I think that's it. And thank you so much.
Thank you so much, Sarah. That was excellent. And there was another question. It's a very good question, but unfortunately we are running out of time, but I did send my email. I'm happy to follow up. So I really want to thank Jose, of course, and Sarah for all your wonderful work over the last many months. And thank you all for joining today. Thank you for the international sign interpreters and the captioner and all the support from IDA with the logistics. Thank you so much. We will send a recording and all the details, all the resources that we mentioned. So please be in touch, and thank you so much, and have a wonderful day, evening, afternoon. Thank you, and bye.
Thank you.